Good day to all of you, irrespective of from where you are joining. It's a pleasure to chair this session. Let me first come to keynote speaker one. Professor Dominic Abrams is Professor of Social Psychology and the Director of the Center for Study of Group Processes at University of Kent in United Kingdom. Following his vice presidency in social sciences of the British Academy, he was the academic lead for its major multidisciplinary review of the social impact of the pandemic. The two substantial reports from that work focus respectively on the impact and on the policy implications for the United Kingdom. Dominic also chaired the British Academy's program on cohesive societies and is currently co-chair of the joint BA NAFI Foundation research program on understanding communities. He's also a trustee of the Anne Frank Trust. With that, his primary academic work is on the psychology of inclusion, equality, and cohesion, and particularly the role of group membership and identity in this phenomena. He has published over 300 articles and papers and several books. He's also the co-chair and editor of the journal Group Processes and Intergroup Relations, published by SAGE. With that introduction, now let me invite Professor Dominic Abrams to make his presentation.
Thank you very much, Professor Silva and Professor Diaz. Well, I hope you can all hear me. It's a pleasure to be here, and thank you for inviting me to give this presentation. I'm going to share my screen, so this might be the last you see of me for a little while, but please let me know if there's any problem with the screen share. Okay, well, hopefully you can all see the cover page there. So back in September 2020, the British Academy was invited by the Chief Scientific Officer for the UK, Sir Patrick Vallance, to try and understand what would be the long-term societal impacts of the pandemic. And this led us to an extremely intensive process where we tried to gather evidence from across the humanities and social sciences and beyond to really understand what might happen and how we might handle it. And there were 5 phases to the program of work, which began with desk research, and by inviting, I think we had input from about 200 experts and stakeholders on what they thought was the current evidence and the likely issues facing them. And from there, we moved on to a rapid evidence synthesis and tried to create a framework for analysis that would then provide the basis of synthesis discussions, with each of which had about 20 to 30 academics in from multiple disciplines, where we try and explore what the evidence meant and which evidence was the most compelling. So I'll talk a little bit more about what emerged from those workshops and what led to our phase 4, the final reports, and work we've done since then. So in trying to frame this question, obviously it was a very broad question that we'd been set, we decided to look at 3 general areas of policy focus. 1, health and well-being; the 2nd, community, culture and belonging; the 3rd, knowledge, employment and skills. And for each of these areas, we looked at several cross-cutting themes, and these involved governance, the way that things were being managed and organized; trust, the extent to which people were willing to comply with various restrictions and rules; cohesion, the extent to which people were working together to deal with the problems facing them; how this was impacting levels of equality and inequality; and the extent to which there might be implications for sustainability. And with those themes, we also decided it was critical to look at the context. And the context was defined in terms of the impact of particular places. And we considered place at local, regional, national, and international scales. The scale of management or organization, or the unit of analysis, if you like, so whether it was individual, community, or societal, and also the historical context, which obviously has implications for precedents for what people have done before, but also for cultural and other kind of aspects as well. And so there were kind of deep dives into each of these things, and the specific pieces of evidence are available at the British Academy if you're interested in looking at them. And then we also try to consider different scenarios, different situations that might unfold, ranging from completely successful mitigation of the virus threat through to a persistent or manageable threat, through to a prolonged economic and social crisis. And I think, interestingly, our government, you might have heard, has just announced it's about to cease all legal restrictions on behaviour, and indeed cease routine testing, self-isolation and everything from Thursday this week, which might imply scenario one. I think at least we're in scenario two, and quite possibly still in scenario three, and likely to be for some time. So the reality and the way that the governments choose to respond to that reality might not always fit. But each of these has different implications for the stresses placed on various sectors of governance. And here's an example from the charity sector. So we tried to understand the nuances and complexities of all this all together. So our first report was really looking at the evidence itself, and this runs to about 170 pages, but if you would like to read it, then you'll find it's conveniently separated into chapters that focus on each of our three themes. And what I'd like to do today is just give you a flavour of some of the types of evidence that we looked at and some of the conclusions that we reached from all of this. So in the area of health and well-being, we looked at a range of themes, including health inequalities, what was happening to mental health, the impact on the social care system, the way that the pandemic might unfold and last and affect people, and problems such as long COVID, the way that health information was being shared and used, the way that health data was being gathered and combined, and the impact of environmental conditions. And just as one example, and this you're probably familiar with, and it's to be familiar in many countries, the UK already had quite a high degree of inequality even before the pandemic. And what we saw here was at the COVID rate, and this was in 2020. And what you can see is that the poorest people, these indices of multiple deprivation, the blue line is those who are the most deprived. Those who are most deprived had the highest COVID rates, and this was true at any age level. But there were also very important local variations that were dependent on where people were living. And if you looked at places that were particularly deprived, there what you would find, although at the time the death rates were higher amongst older people, that actually hospitalizations were higher amongst younger people in areas of high level of deprivation. This picture shows, for example, that older people living in Trafford, area in Manchester, relatively well-off area, an area of low deprivation, was doing very well. They had few hospitalizations and deaths, whereas those living in Salford, an area of high deprivation, younger people actually were particularly badly affected. So the specific effects of the virus and the pandemic were not just simply a function of age or simply a function of poverty, but often the combination of the two, as well as the particular location and place where things were happening. This is a more recent piece of evidence, and this looks at years of life lost as a measure of the impacts of the pandemic. And the blue lines here you can see are what would have been predicted in a normal year. The red lines are the actual numbers of years of life lost. And as you can see, the peak and the impact of the pandemic was much more serious for those who were the most deprived, at least twice as bad. So the impact of deprivation is very clear. But also, we have to remember this was not just a health pandemic in a way. It's also been a social and economic one. It's affected people's behavior, and it's affected their economic circumstances, as if not more severely than the health outcomes in some cases, and certainly more directly and more immediately. So for a large number of people, they behaved differently, they responded differently to what was happening, and they had different outcomes. This graph simply shows that in different parts of England, people were less likely to wear masks. So in the north of England, for example, working class people were less likely to wear a mask. Younger people, Conservative voters, people who voted to leave the EU, men, were all much more less likely to wear masks than those who were older, female, middle class, voted Remain, and so forth, or who lived in London. So significant behavioural differences, which of course also had health and other outcomes, but those behavioural differences will have reflected the social circumstances that people were in, and not just the health situation. Our second area was knowledge, employment, and skills, and for most countries there's been a very substantial impact on education, on the education system and the experiences of young people, but also on employment structures, the continuity of employment, and so forth. And so here we looked at the experience of education and skills building, what was happening in further and higher education, the stability of the economy, effects on employment and income inequality, and some of this materials from the Institute of Fiscal Studies, who identified two major trends. The first trend was that of rising unemployment, and this was particularly for young and less educated people. So although the government did roll out a very substantial program to support furlough and benefit increases, universal credit increases, which did protect quite a large number of people, only some people were supported by these schemes. Many people were not. Many self-employed people were not. People who undertook more sort of casual forms of labour and so forth were not protected so well. And the extent to which people were able to work from home, continue to work relatively unaffected, was very different across different parts of the population. So there were things like apprenticeships ceased, overall training stopped, education was very seriously disrupted. Just as an example, if we look at the decile of earning distribution and look at who was in lockdown, who was affected by lockdown, and who wasn't, we see a very clear linear relationship. The higher one's income, the greater freedom one had not to be behave as if in lockdown, or not to be restricted by lockdowns. But equally, if we look at people who are able to work from home, we also see a similar type of gradient, which is that those people who are actually least affected by lockdown itself were also much more likely to be able to work from home. So the working conditions and the constraints and the complexities of dealing with those was much greater, and the freedom in a way to avoid the virus as well was much greater as you moved up the income distribution. So we can what I'm hoping you're capturing here is these drivers of inequality becoming more severe the poorer people are. Education, I'm not sure what the situation would have been in Sri Lanka, for example, but certainly in the UK, although all children missed out on education, this was substantially more severe for children from poorer families. So this is children's daily learning time during periods of lockdown. And what you can see is, here we have the richest quintiles and the poorest quintiles depicted. So at primary school, so up to the age of 11, you can see that online classes were available to the richest, other schoolwork was available, private tuition was available to many of them, and other forms of education were a bit more balanced. But big differences there. In secondary school, where children were taking the critical public exams, GCSEs and A-levels, the differences are, if anything, even more stark. Substantial provision for those in the richest quintile and big gaps for those in the poorest, particularly the availability, for example, of private tuition. And typically, private schools were able to carry on providing face-to-face classes as well as online tuition, and state schools tended not to be able to do that. So very big differences, which of course have led to substantial differences in other types of outcomes, such as access to the best universities, resulting from assessments and performance. So three types of inequalities seem particularly likely to be exacerbated. Income inequalities between the richer and poorer households, socioeconomic inequalities in education and skills, and also intergenerational inequalities between older and younger people, and between proximal generations of students and children, some of whom had managed to graduate before the pandemic, and others were severely affected by it. The third area we looked at was that of communities, culture and belonging. And here we looked at the way that people had responded to the challenges of the pandemic in terms of volunteering and mutual aid, levels of cohesion and solidarity, trust in the government and others, the role of place and cities, what was happening to prejudice, discrimination, and social attitudes, and the role of arts, culture and sport, and whether that had been maintained or managed to continue to support communities. So when we were considering communities, we looked at all sorts of aspects of the ways that communities were working. There were transformations, for example, in the use of public spaces, high streets. Transport use changed dramatically. Although people stopped using their cars, they also stopped using public transport as they were fearful of being infected while doing so. And the financial viability of many of those systems came under enormous strain as well. Social attitudes seem to range from the mutually supportive and unified to prejudice, scapegoating, blaming, all kinds of things going on between different groups, expressed as localism, regionalism, nationalism, and in other forms. And we saw really severe strains, and in fact the decimation of some parts of cultural arts and sports infrastructure as well, all of which is going to require some rebuilding. We also looked in detail at trust, and of course we know there's plenty of evidence now that trust is critical for people's compliance with rules and regulations. So it was interesting to see what was happening to trust across the pandemic and what implications that would have. And I'll just show you a couple of examples from some of the findings here. So this is a sort of integrated analysis from multiple different surveys that had been being conducted throughout 2020. At the start of 2020, the UK just had its departure from Europe sort of consolidated by a Conservative victory in the general election. We were now about to move into proper leaving of Europe, Brexit. But that whole period was marked by an enormous amount of conflict and distrust between groups across the country. The lead up to Brexit had caused a huge amount of social division. The blue dots here are percentage of people who express over distrust of the government. Red is distrust, blue is those who trust. And what you can see is that distrust massively outstrips trust. Now, as we went into the pandemic, we saw, and perhaps for the first time in a long time in UK politics, that more people trusted the government than distrusted the government. So this was May 2020. So there was a sort of unifying, coming together, agreeing that we had a common problem and that the government could be relied upon to support us through it. But that dissipated extremely quickly. Dominic Cummings's trip to Barnard Castle, which you may have heard about, coincided with this switchover again in levels of trust. But I think that was only one of the factors. The situation also became more complicated for people. Different rules were applied in different places and around the country and between the countries within the UK. There was greater uncertainty, and as all of that happened, we reverted back to a situation where there was a very low level of trust in politicians and a high level of distrust. And in fact, more current evidence suggests that that trend has simply continued, that we're still in that state. So public trust was gained, but then lost again. So what happened in terms of cohesion? And this graph shows feelings of division and unity among people in the UK and in local communities. So if we look first at these dark blue blobs here, this is the percentage of people who felt the UK is becoming more divided. And at the time of the general election in 2019, December 2019, the country was very divided. But again, we see this trend towards unity in May 2020. So the light blue dots are the people who think that countries are becoming more united. And again, as with trust, unity exceeds disunity only at this period of May 2020. And then things revert back to social division again. So perceived unity is quite low, perceived disunity is quite high at the national level. So this is unity between the countries of the UK and generally across the UK. However, a very important distinction needs to be made between levels of unity and indeed trust at the national and the local levels. So the yellow dots here, the dark yellow dots, are perceptions that the local area is becoming more divided. And what you can see is that, first of all, that's much lower than levels of national disunity, much lower. And secondly, that it doesn't change very much through this period. It doesn't have this upward curve. And similarly, feelings of unity at the local level, which are higher than at the national level, maintain that level pretty well, even though things at a national level are changing. So this is quite an important distinction, which is that people didn't simply lose trust or lose unity. They focused this much more at a local level, and it was the local level that sustained, I think, both trust and unity, but also sustained compliance with many of the rules and regulations that were in place. So I think an important lesson. At the end of all this, we identified 9 overall significant areas of long-term impact. And these were, first of all, the increased importance of local communities in enabling people to weather this huge storm of the pandemic. That there are low and unstable levels of trust, and that these are an important factor in who complies with what and why. That the geographic inequalities that had existed already before the pandemic in the UK had started widening, and that other structural inequalities had also been exacerbated, for example, in educational outcomes and health outcomes as well. I think people's attention was drawn in a very distinctive way to the importance of mental health and the impact that that was having on people's ability to cope on their lives and their livelihoods as well. I think that has now gained actually greater priority in health planning and thinking. Enormous pressure, of course, on revenue streams. So although the government has piled huge amounts of money in all over the place, it's now trying to rein back and to balance the books again. And that's going to mean that continuing to build on what has been achieved is going to be difficult. Rising unemployment, changing labour markets, well, I think it remains to be seen quite how that's going to pan out. And in the UK, it's made more complicated by Brexit, which has meant that we don't have the same level of access to European labour as used to be the case. And a renewed awareness that education and skills have to be more of a lifelong process and can't necessarily all be crammed into the usual 18 years at school and university. Now, from all of this, we developed a set of policy recommendations, and the critical point of all this was that each of those 9 impacts have to be considered in concert as a set of things operating together and connected to each other. And therefore, in order to address any one of them, we would need to be able to address all of them together. And that, we thought, required 7 key policy goals. One was to much better integrate the governance structures, to have better linkage hierarchically, so that what the government was doing was better linked to what was happening at a local or hyperlocal level. but also horizontal structures needed to be linked. So what was happening in different localities needed to be connected up better as well. That I think we discovered a number of weaknesses in the way we were sharing information and the way that people could get access to that sort of information. For example, local intermediaries were particularly important in communicating information about vaccines and getting people to take vaccines and so on. And although we need to improve our digital infrastructure, that is not just a question of giving people equipment or connecting people, but also enabling them to use that infrastructure, to giving them the education and the resources to understand what information they needed, how to use it, how to capitalize on that infrastructure. I think a real understanding now that urban spaces could be used differently from the way they had been before, and that could be a part of building a much more sustainable approach to the future, both in cooperation with business, but also local authorities and health systems as well. That the education system is going to have to adapt and change and be more responsive to people's needs over their lifetime rather than just in their early lives. But community-led social infrastructure is not really just a luxury, it's essential. And so that when these kinds of challenges emerge without those infrastructures in place, it's very difficult to respond and adapt quickly. And that we need to prioritize social purpose in the way that we try to rebuild the economy and society, that it's not just about making money, but it's also about building a strong society. We also then came up with 5 principles for good policy making, which I won't go into here, but these really are about the way that policy is structured, the way that it's developed and created, and the extent to which we involve other people other than the policymakers and government in developing those policies, the way we connect policy to people's lives. But I think I'd like to just mention briefly where we got to in terms of our engagement with both the political system and the wider international context. So following our reports, we've had a very long series of meetings with the strategic advisory groups on emergencies, with the government cabinet permanent secretaries, chief scientific advisors, the COVID task force, civil servants from all sorts of departments, as well as media engagement. The other thing we've been doing is reaching out to other partners internationally, and recently you may be interested to see the statements made by the Social Sciences and Humanities 7, which is the G7 countries, social and humanities bodies getting together to consider what are the really big questions for recovery from the pandemic as a more global level. And I'll just leave you with this, which is the different themes that the Social Sciences and Humanities 7 came up with. So community engagement, education, skills and employment, trust, transparency and data gathering, inequalities and cohesion, and fiscal policy. So these 5 areas, and there's a report on each of these you can find on the British Council website, I think are these interlinking themes which both emerged from our review and which I think are emerging internationally as the key areas where attention is needed. And I see from the program for the rest of this conference that you indeed will be exploring all of these. So thank you very much for your attention.
Thank you very much, Dominic, for that excellent presentation, which gives a very solid start for this webinar. I don't see any questions in the Q&A section. Maybe people are feeding in some questions. Until that happens, let me make a comment and maybe ask a question from Dominic. Actually, I think you have provided a very solid evidence base for exploring the long-term social impacts of the pandemic, primarily based on UK experience. And from what you have presented, it appears that the socially disadvantaged have been more vulnerable and more exposed to the pandemic. And also it looks like the adverse impact of the pandemic on that particular section of the population is much greater based on your finding. One question I have is, to what extent the same arguments can be made about the rest of the world, both in Europe and maybe elsewhere, whether you have been able to get some information from the rest of the world, maybe through a literature survey kind of thing. And secondly, this is a question that came from what you said towards the end, about the policies and implications and the impact, and also looking at issues like trust and social harmony. And from what you presented, it appears to me that there is no clear pattern. Actually, it seems that in the initial period there was some trend towards trust building, but towards the end the gap increased further. What I want to know is whether the dynamics of the pandemic itself contributed to these developments, or whether these developments can be attributed more to the larger kind of political and social trends in the country. I will leave you with that and maybe expect a few more comments and questions.
Okay, thank you very much. Well, I think clearly there have been different patterns in different countries, and these reflect the difficulty in making direct comparisons, is that these reflect both political and cultural differences. So, for example, in Denmark, I think there's been much more emphasis on leaving people to make their own choices and behave responsibly. And in many of the Scandinavian countries, I think the social obligations and norms are quite strong and clear, and so they required less government intervention or imposition of rules. And so trust, in a way, was sort of built in more to their systems, and to the extent that they were able to be consistent about what instructions and guidance they were giving, it was relatively okay and easy for people to comply with those. In other countries and other situations where there's low trust or less trust, then the imposition of rules is one way to get everybody to do the same behavior. And it's once you have people all doing the same thing, of course, they feel there's a sense of unity and will comply. But it's vulnerable. And I think what happened in the UK and quite a few other countries has been that when government becomes inconsistent or unclear in its guidance and its imposition of rules, and it starts saying things like, this is a matter of personal responsibility, it's up to you, then things can break down. Now, what we saw, I think, in the UK and will be true elsewhere, is that where you have a strong local infrastructure and strong local networks, that it's possible to sustain norms and to use local informants, as it were, local experts, to help guide people's behavior, for example, to encourage them to take vaccines. We found that communities that were better supported in terms of investment in their cohesiveness tended to fare better as well through the pandemic, that they drew on their own resources. So I think the relationship between trust and other things is complicated, and it does depend on the context. But of course, inequality, I think, is always going to drive inequality of income, inequality of life circumstances is always going to drive inequality of health outcomes as well. And of course, we've seen large parts of the world where very high proportions of people haven't been vaccinated. And because many countries behave somewhat selfishly in the way that they decide to implement their policies and not cooperate with one another, again, we can see the vulnerability of the weakest increases as a result of that. So I certainly take no pleasure in the failure to roll out the vaccine much more effectively on a global scale. And I think there's also a desire for governments to be complacent about how well they're doing, when in fact it's evident that no government is doing incredibly well and that some are doing quite badly compared to what they should be doing.
Sorry, Tudor, this is
yes.
Priyan here.
Yes.
Can I just make an intervention? There is a small technical difficulty in that the panelists are not able to put questions in the Q&A. They can only ask them in the chat. That's a technical issue with Zoom. So you might be interested in a question from Jim Ackers in the chat, and maybe Dominic can have a look at it as well. Only if you think that that's suitable. Yes, it's in the chat.
Yes, Jim Ackers, has a question in the chat. I wanted to put this question into question and answer, but could not access.
The chat box is available. Q&A is not possible.
Okay.
I can
further
see
up.
If we wish to type anything, we are not able to type.
Dominic, can you see that? Further up
from
Jim.
Question.
I can see it, so I'll read this out. It's okay.
But can I pick a few questions which are put in the Q&A? Can I begin with that? I think Lahiru Kodituaku from Sri Lanka has this comment. Many thanks for the excellent presentation. My question is, do you have any evidence during your study regarding any association between the public trust in government and the vaccination drive? Did you get it?
Yeah. Yes. I mean, I think there are many studies across the world actually which show that there is a relationship between trust in government and vaccination uptake, but it's clearly more complicated than just trust in government. So if people trust their local community leaders, they trust those that are guiding them to be vaccinated, then they will tend to be vaccinated. I think those who, certainly in the UK, who haven't been vaccinated, there are very many reasons why not. One of them is simply complacency, which is the sense they may be not vulnerable to the virus. Another is concern that they may be more vulnerable to side effects of the vaccine than of the virus. And the third reason is indeed their distrust in government, that the government has some ulterior motive. But actually, we've done some research that reveals something we call distrustful complacency, in my research group, where actually it's the combination of feeling complacent and distrusting the government that seems to be most predictive of not taking vaccines. So it's a combination of factors, but certainly if one of those two factors can be effectively addressed, that is to say people can be convinced that they will be safer by taking the vaccine, or they can be convinced that the government's intentions or reasons for asking them to do so are good intentions and well-meaning, then there's a good chance they will take the vaccine. So, but for many people, it's either difficult or been impractical, or vaccines haven't been available, all kinds of other things. So I think we have to be very careful about understanding the reasons for this, and not blaming individuals necessarily for those decisions or lack of taking vaccines. Another question was from Jim, actually, was about the impact in schools and whether trust was an important factor there as well. And I think the answer is yes. But again, we've seen, I think, uneven sorts of effects, so that in schools in small communities, for example, where it's been easy to share information and have a consensus about the way that pandemic should be managed and what the school policies would be, then parents would be very cooperative and work with the school very closely. A lot of parents were very badly affected by having to either homeschool their children or take time off work to look after them. I think in the private
Thank you, Dominic.
sector, for example,
I think we also had a question from
the public sector.
We also had a question from one of our panelists, Dr. Ranjit Mahindapala. Can you unmute and ask it yourself, Ranjit?
Yeah.
Hello, Ranjit?
Yeah, I will.
Okay.
I will. It relates to the excellent presentation, Dominic. But I noted that there is a difference between mask wearing between conservative and Labour, and they're very surprising. And does this mean it is a distrust on the government, or simply overriding the scientific evidence that have been put in? Thank you.
Thank you. Well, it's a slightly more complicated question, isn't it? Because a lot of former Labour voters voted Conservative at the last general election. So when one defines people as Labour and Conservative, they aren't in that state forever. Clearly, they move around. And if people voted Conservative, then it would be strange that they didn't trust the government. So I don't think it's necessarily so much about trust in the government, and more about prioritizing the value of freedom and liberty. It's sort of individualism, I think, more than anything else. And that does exist amongst both Labour and Conservative voters, although is more prevalent amongst the Conservative voters. So I think, that the rhetoric of individual choice and freedom around this pandemic has been quite difficult, because, of course, we want to give people as much liberty as possible, but not necessarily at the expense of the whole of society. In this country, there's been a lot of internal pressure in the government to have greater liberty, greater choice, greater freedom. I think not always at the right moments, but that I think is why there are differences in mask wearing between Labour and Conservative voters. So it's more about their values than their political orientation.
Thank you, Dominic. I think we will take just one more question, and we have one in the Q&A by Mustafa Javara. Having learned through the hardest way, do you think this COVID-19 travesty among the lowest income group could have been averted had the politicians and policymakers paid attention to fixing inequalities?
In short, yes, but they would have had to have started a long time ago, well before the pandemic. But I do think that more could certainly have been done in the UK to make things less terrible for those who are already most disadvantaged. A lot was done, though. I don't think we should underestimate the huge investment that was made in trying to support people who were most in need by the government. But I think we weren't well prepared for this, even though we knew that a pandemic was coming down the line. We hadn't got ourselves as well prepared as we should have. And that's why those who were most vulnerable, either by income or in health terms, have suffered disproportionately.
Thank you, Dominic. I think we will have to leave this right there. And thank you so much for giving us a very useful presentation and a very useful keynote speech. We will set the tone for the rest of the webinar. Actually, we will come back to a lot of issues you raised, including the issue on education and inequality in later sessions. Thank you very much.